Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Joining me today is President and CEO Jennifer Montgomery to talk about the comprehensive emergency services available at McLaren Port Huron. Jennifer, thank you for joining us today.
Thanks for having me.
Now, I know that McLaren Port Huron and previously Port Huron Hospital has offered 24-hour emergency care for many years. How is the care different now than it used to be?
We have recently gone through the process to become a Level 3 designated trauma center. So the care you're going to get at McLaren Port Huron now is following national standards and guidelines.
So for our audience to better understand, what exactly is a trauma or a traumatic injury?
So a trauma could be something as simple as a fall all the way up to a major car accident, a bicycle accident. Sometimes you see that you have injuries sustained through a harm event like a stabbing or a shooting. Here up in the Port Huron area, we're in a rural area, so we see a lot of motor vehicle accidents up this way. And 25% of all motor vehicle accidents actually can happen in a rural area. And when you look at the death though from those, 66% of deaths occur out of those. So it's really trying to take a rural area and make it a safer place.
So why did McLaren Port Huron feel the need to pursue this type of designation?
So McLaren Port Huron is always looking to expand our services and to try to do it better than we've done it in the past. So pursuing trauma designation really helped us do that. It also gives us a chance to showcase our surgeons. Our general surgeons are a huge part of the trauma program, and our orthopedic surgeons are. So this really is a chance for our community to have great care locally.
Now, Jennifer, why did McLaren Port Huron decide to pursue a Level 3 designation as opposed to a Level 1 or a Level 2?
So there are really 4 designations in trauma, and you could be a Level 1, and that's a teaching hospital that's doing research around trauma. So that would be a hospital that maybe has residents or fellows that are in the trauma program. And then a Level 2 would be just like a Level 3 with the additional service of a neurosurgeon. So we do not have a neurosurgeon 24/7 on staff up here at McLaren Port Huron. The advantage though of being part of a system is that we have access to neurosurgeons both in Flint, Lapeer, and actually in McLaren Macomb too. And we have agreements with those neurosurgeons so that we can call them directly, and if we have a trauma that we're going to ship out because it is a head injury, they will be on call and ready to go.
Jennifer, with our trauma center designation, will other hospitals be referring patients to us?
Yes, so much like we have transfer agreements to ship out more acute patients to other hospitals, we have agreements with hospitals that are maybe more rural to us that don't have the 24/7 services we have. So we have agreements with them, and they will ship their trauma patients to us, and we'll take it from there.
So in addition to McLaren Port Huron being designated as a Level 3 trauma center, what else sets McLaren Port Huron Emergency Services apart from other hospitals?
So McLaren Port Huron Emergency Services has some unique features. We offer 24-hour psychiatric treatment at this hospital, so that's a service that's not provided elsewhere in the county. We also have an open heart program here, which means we can do interventional cardiology, so patients that are having an acute heart attack can be treated appropriately, meeting national guidelines. And then we have a stroke program here, and we are a certified stroke center.
Jennifer, this has been great information. Do you have any closing comments for our viewers?
You know, McLaren Port Huron is going to continue to look for better ways and more efficient ways and the best practices to provide care for our patients in the community.
That's great. Jennifer, thank you for being here today.
Thanks.
Stay with us. We'll continue after this message.